Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today there's one new case of COVID-19 to report. The total number of cases is 331. Today's case is a male in his 30s from Southern Health. And public health investigation is ongoing. The 5-day test positivity rate is 0.16%. There are 6 active cases and 318 individuals have recovered from COVID-19. There are no individuals currently in hospital or in ICU. An additional 734 tests were completed on Wednesday, bringing the total to 73,042. I've continued to hear reports of people gathering in parks and outside beaches and not adhering to physical distancing. Again, a reminder that we're not done with this virus. This virus is not done with us, and so we need to continue the practices that got us here. The physical distancing is still important to adhere to as we move forward, as we continue to reopen our economy. We need to continue pay attention to this virus. Manitoba Parks has reinstated a life jacket loaner program in 11 provincial parks. There will be some occasional cleaning efforts done on these jackets, but it's certainly determined that the risk of transmission is relatively low in these circumstances, and it's balanced against the risk of harm from drowning for people not wearing life jackets. So I encourage park visitors to bring their own life jackets if they have, especially if they're a novice or non-swimmer. Another reminder to businesses in Manitoba that the public health orders are still in place and we're still dealing with this virus. So again, we hear reports of crowded spots, not adherence to the distancing. And we still see cases where we're going to continue to see cases. If one of those cases was in a crowded venue, that's where we can see the spread of this virus. So during a pandemic, we see this virus all around us. We can't expect 0 cases. What we can expect is that when we see cases, we don't have numerous contacts to those cases. And that's the whole purpose behind staying home when you're ill, frequent hand hygiene, and avoiding these crowded, enclosed spaces. So we need everyone to do their part, including businesses. And again, most Manitobans and most businesses had stepped up and continue to. But just we're hearing some reports. It's easy to slip back as we try to get back to some sense of normalcy. But everyone's got to keep in mind that we have to still respect this virus. We can't put ourselves in situations where we can have a large spreading event. So again, just moving forward, Manitobans, we're all well versed on the importance of what we need to do, especially as we move forward into perhaps a busy fall season. Stay home when we're ill. That's a big difference. So people need to start planning now for a lot of absenteeism this fall. When people with low, mild symptoms, we just can't have them at work. Can't have them at school. So we need to start planning to see those absenteeism rates. Everyone starts making their plans for those type of things. If members of their family are ill, what can they do in the fall, and start preparing for that. Good hand hygiene. We talk about masks, and certainly right now there are no plans to mandate masks in Manitoba from my standpoint, but they are going to play a more important role over time as we continue to open up the economy. As we move into respiratory virus season, we're going to be hearing more and more about masks. So I think Manitobans start paying attention to these non-medical masks, how to use them properly, especially in areas where you can't maintain physical distancing. And we're going to keep Manitobans apprised of that. So same messaging to individuals who are at increased risk of severe outcomes, those over age 65, those with underlying medical conditions, those with immune compromise, have to take extra caution. You should be very careful to, if you're going to attend places that are enclosed, that are crowded, you need to do whatever you can to try to maintain that physical distancing when all possible. Continue to visit our website, manitoba.ca/COVID-19 for up-to-date information. And so thanks. I'll open up to questions now.
Dr. Roussin, the Premier indicated this week that you gave him some advice prior to his trip to Ottawa, that specifically he said that you told him that a 4-day period of isolation or upon arrival in Ottawa would allow him to monitor his symptoms and see if he caught anything on the plane. Can you clarify exactly what advice you gave the Premier?
Yeah, so the advice there was not unlike advice I would give to anyone. That I cautioned that certainly at that time the incidence of COVID was much higher in other parts of Canada than it is in Manitoba, so you need to take caution. So I advised travel directly from the airport to the hotel or to meeting areas, to limit exposure in public, to carry hand sanitizer, and to closely monitor symptoms. Upon arrival back in Manitoba, there is no requirement under the orders to self-isolate, but should closely monitor symptoms and limit really concerning exposures in crowded places at first.
Would you advise, though, any traveler, business traveler or politician flying to Ottawa or Toronto, do you recommend that they self-isolate for 3 or 4 days or upon arrival at their destination before attending meetings, or can they just attend meetings?
Yeah, I think that the most important thing is to take the caution all the way there. So during travel, to ensure hand hygiene, physical distancing whenever possible. Those are the most important things. We know that at least half of cases will develop symptoms within 5 days of exposure. So if you have a short period of self-isolation, that's certainly better than nothing.
Right. So if I'm traveling to Ottawa and I plan a business trip on, let's say, Tuesday, Wednesday next week, and you're not suggesting that I need to fly out today before such a trip?
Yeah, I would say that's not probably the most important aspect of what I would give. If you're attending some place where physical distancing might not be possible, you need to get out. Then, if you're able to self-isolate and assure that during travel you haven't been exposed to anything, then that's better than nothing. But I would say the most important thing are the basic type things we talk about.
Dr. Roussin, you kind of talked about businesses that might not be adhering to the rules as closely as you'd like. Certainly, I know we can all think of one business that's been the recipient of 2 tickets so far. What can you do if it becomes clear that maybe a business is just getting tickets kind of continuously, things aren't as they should be? What happens then? Like, what's the limit?
Yeah, I think that it's by far the exception. In Manitoba, we see a lot of restaurants, a lot of businesses operating without a warning, without a fine for sure. Those that get warnings are able to do this. So, I think that there are measures in place. Under the Public Health Act, you can there's ability to institute greater fines with it, but it requires more of a prosecution if necessary. So I think the biggest thing is education and education of the public, right? So these businesses that we saw. If there's crowding and things going on, that's the public involved in that as well. So again, if you find yourself in a crowded place, you really have to recognize this virus is still here, and really don't want to be putting yourself or family at risk in a crowded, enclosed place right now.
And kind of following up, thinking to things that aren't open right now, cinemas, movie theaters, do you anticipate them opening anytime soon in the coming weeks or months? And what would it take to kind of get that back in action?
Yeah, I do anticipate that, and we are working on such a plan now. We have probably more information, probably next week on that. We're going to try to do the same consultative process again, but I do foresee that we'll be able to open more things.
Dr. Roussin, with the 5 cases announced earlier this weekend, today's case, is there any evidence of community-based transmission of those cases?
So of those cases, there's one case that we're going to classify as for sure as unknown acquisition, which that would meet our definition of community-based transmission. Another case there that we haven't classified as of yet. The rest are related to travel or close contacts cases.
We've also heard some concerns with workers in an agricultural facility near Portage la Prairie traveling back and forth to Southern Ontario and Quebec without self-isolating, and we've been hearing concerns about them, coming back and going into the community. Have you heard of this, and what's your response to that?
I'm not aware of a specific issue like this. Our travel orders have always had some exemptions for if they met some of the critical infrastructure or some of the essential work that's in there. I think the message is the same no matter where you are or where you're going. If you're traveling outside of Manitoba now, whether it's in an area that isn't restricted, or if it is an area restricted, you have to take those cautions, the same precautions that I advised the Premier of, is that sanitize your hands frequently, don't travel if you're ill. No matter where you are, you should be practicing that physical distancing, avoiding crowded, enclosed places, and monitor for symptoms very closely. So we're again monitoring the epidemiology of Canada, and we're still considering further loosening of those travel restrictions as well.
Can you be more specific as to which cases now classified as an unknown acquisition, which health region that fell
Southern,
in?
yeah, in Southern, a female in her 20s from Southern would be classified as unknown acquisition.
Okay. And of the, I guess there's now 3 or 4 in the Southern Health region. Are those out on the Hutterite colonies at all, or are they, or can you say where those are located?
Yeah, so for, right now we will, Public Health will announce more and more details about cases, or if there are clusters, if we feel there's a public health risk that requires that. So right now we don't see that, so we're not announcing any more details of those.
Okay, thank you. We're going to go to the phone now. Up first, from the Brandon Sun, Bud.
Yes, Dr. Roussin, could you expand a bit more on reopening, particularly for movies, theaters, and casinos? Have you reached a decision when those could be reopened? They've been closed quite a while.
Well, we don't have a specific date on it, and we don't have a set criteria on it. It is something we work with. We've engaged those industries and have some preliminary thoughts, and more to come next week on that, and we're going to try to do the same consultative process as before.
All right, thank you.
From CBC Radio Canada, Gavin.
Hi, Dr. Roussin. I've been hearing from a food service establishment in Winnipeg that they've implemented ID checks at the door, and they will be excluding any person who can't prove they reside in Western Canada, because they've had a problem with clients coming up from apparently from North Dakota, from Quebec, from the Atlantic region, and in all these cases, the clients told surfers they didn't respect the 14-day isolation period upon entering Manitoba. Are you aware this is a problem, and what sort of thing is the province doing to enforce this 14-day isolation period upon entering Manitoba?
Mm-hmm. Yeah, so I'm not aware of that specific situation. I think that again, when we talk about overall, we need to be kind to each other during this time, and be careful that we're not perpetuating stigma or causing undue harm during a difficult time for everyone. So people who may not prove that they can live, that they currently live in Western Canada, doesn't mean that they haven't been here through an exemption. Doesn't mean they haven't self-isolated for 14 days. So there's lots of issues when we start classifying people by their license plate or their what it shows on their driver's license. So I'd be cautious about that. I think that being aware and being really thoughtful about this virus is great, but we have to know where we draw that line where it becomes stigmatizing or harmful. So I would advise people, the most important thing is to ensure that ill people aren't showing up to places of business, that there's opportunities for hand hygiene, that there's good physical distancing. Those are the most important messages.
As a follow-up, just on the second part of my question, what does the province do when someone flies in, say, from Quebec? Does the province do anything to ensure that the 14-day isolation period will be respected?
Yeah, and so with the orders that we've had in place, and they've been in place for quite some time now, and actually loosened from where they were, we've had very little enforcement on that. The province hasn't been actively following or searching out people for those self-isolation periods. We've been providing mostly information and the importance of it. So certainly under the order, there's an ability to enforce that, but we haven't found the need. For the international travel, the federal government under the Quarantine Act does have some follow-up in place.
From CBC Manitoba, Aidan.
Hi, Dr. Roussin. Aidan Gary from CBC News. I'm just wondering, why did it take so long for the province to notify the public about these flights that had the symptomatic passenger? I think in this case, the 14-day isolation period had already concluded for one of the two flights, and it was like a day from ending for the other.
Yeah, I think in that situation, it was the timing of receiving the result of the positivity. So just like before, there's been some examples. We typically announce cases once per day, but if there was any concerning findings, like we had an example in a grocery store exposure in Southern, you may remember a number of weeks ago, then we'll announce that whenever, as soon as we get it. And so it'll be the same thing. We once we get a positive case, we do the case investigation. As soon as we're aware of the of a potential important exposure to the public, then we'll announce it. So it's the delay in this case was the testing and the result.
And in this case, was the person symptomatic on the flight? The provincial website listing flights indicates that any flights listed there did have symptomatic people on them, and if they were symptomatic, will they be fined?
Yeah, so I don't have the details. What we would say is that this person was in the infectious period during that time, and so that includes 48 hours before the onset of symptoms. So that was probably the more likely scenario there. Our public health orders don't really have that in them, that fining people traveling while they're symptomatic. That's more of a issue for the operators to ensure people aren't symptomatic while they're traveling.
From CTV Winnipeg, Charles.
Well, Dr. Roussin, Charles O'Bay from CTV Winnipeg. My first question is, we've had some reports from families who say that they've been limited in visiting their relatives in long-term care homes. Had one person say that they're only allowed a 30-minute visit once a week, for example. I'm wondering if there's a reason for why there are limits in time and hour for care home visits, and if the province will be making any changes to this.
Yeah, so this is a real important issue, and so we are looking at this, and hopefully going to have some guidance for this in the near future. So again, public health, it wants to not provide detailed restrictions on these type of visiting guidelines. We want to be able to provide guidelines that each operator can use when determining the risks and how they operate their facility, because facilities vary. But it's a real important issue. Part of Manitoba's success is that we've been able to keep COVID out of these high-risk scenarios, such as personal care homes, and so we still have to be cautious, but we realize how important this visitation is, and so we're going to work really hard to try to increase the ability for people to visit, certainly in a safe manner. And then, as you're aware, we're looking at ways to keep that visitation up with the upcoming respiratory virus season.
And my second question is in regards to movie theaters and reopening. I know it's been addressed a couple times there, but I'm wondering if you're able to talk about some of the measures that movie theaters would be able to take to reopen. Would they be roping off chairs to surface with things in place, staggering start times to allow for cleaning? Are you able to elaborate on that?
Yeah, and so it's really the right back to those basics. So there's going to be capacity restrictions on it, and then the requirement for physical distancing. So in those theaters, that people outside the household or people who haven't come together are going to need to be distanced. There's going to be needing to have distancing in all of the common areas, so for concessions and things like this. So really the basic type of things that we've already have implemented in a number of businesses, but we're just going to have specific guidance for the theaters.
From City News, Stephanie.
Hi, Dr. Roussin, Stephanie Lipsis with City News. Just wondering if you can explain kind of the significance of that 0.16% test positivity rate, maybe how it compares with other jurisdictions and what it says about our numbers here.
Right, and so I think that the percent positivity is a real good number to follow over time with that trend. That's a better indicator of community transmission and the rate of transmission than just looking at overall numbers. And so we want to try to get Manitobans used to hearing that number rather than cases. We've went quite a long stretch with 0 cases and then had 5, but it was still 5 cases in all of July, now 6 cases in all of July. And so we need to keep perspective that our numbers remain favorable. That number that we report is sort of the 5-day running average of that, and it's just simply the amount of tests, the amount of positive tests divided by the total number of tests. And so we're going to follow that over time. When we look at, say, something like a 0.16% positivity rate, what we're seeing now is quite low. Manitoba's has been overly low throughout most of the time. But we've seen positive test rates in Canada up to 8%, now down more around the 3 to 4% overall in Canada. In some of the U.S. states, I hear reports of 20%, even 30% in some states. I've heard of those rates. So when we keep this number certainly under 1.5%, we're very low. And if we started seeing test positivity rates over 3%, then that would indicate to us that we're likely seeing significant community-based transmission.
Perfect, thank you. Then just a quick follow-up. You said Manitobans might want to get accustomed to wearing masks for the future and that proper use of masks. Can you just go over maybe how to properly use your mask for people who don't know?
Yeah, and so I think that, part of the issue with public health when we, as far as our recommendations regarding masks, is that we observe, a significant proportion of people that are wearing masks, they're wearing them inappropriately. So when you see masks under someone's chin or with the nose not covered, this is, not a good use of a mask. It's not providing protection. And then the real concern is that those people feel that they're protecting themselves and others and pay less attention to to physical distancing because they have that mask. So when putting on the mask, it's important to not be touching your face while you're doing it. While you are wearing the mask, to leave it in place, to avoid touching it or your face frequently. And for the non-medical masks, we have to wash them frequently. So when we're taking them off, be cautious not to touch our face. If we're going to be as we move into this, needing them more frequently, people are going to need more than one mask because we're going to need to be able to keep them clean over time.
Thank you, Doctor. With our remaining time, return back to the floor.
Dr. Roussin, I understand that the Winnipeg Jets and their staff and trainers, etc., they're testing for COVID daily. I'm wondering, are they doing that at public expense, or is it they're doing their own testing?
That's right. Yeah. So they are they're paying for that test for themselves. So the way we have it set up is it's not affecting the province's capacity at all. Even though right now we would have had plenty of capacity to not adversely affect it, but right now it hasn't been affecting our capacity at all, and the full expense of that is being paid by them.
Just have one other question about. You're talking about delays or a delay in receiving information about a case involving one of the 5 cases involving travel, or was there a delay before you found out about it, or?
Like found out about the flight information?
Yeah, or was there a delay in the testing?
That's right. Yeah, I think that as soon as the person was probably tested much after that flight, so we got a positive result, did the contact investigation, heard about the flight, announced the flight, but that time frame was the delay.
Was there an issue with delays involving any of the others in that grouping of 5 in terms of either getting results or making those results public?
Not once we've heard of them. There wasn't there. So when we report our cases once a day. So sometimes, as we speak right now, there might be a test coming in that public health is working on, and we'll announce them tomorrow. We try to keep our numbers straightforward by announcing them once a day. We will announce later in the day if there was a public health need for it. But there's a distinction between when we announce and when work starts. So work starts on it immediately.
Just to confirm for my own clarification, so I'm not super muddled, of the 5 cases announced Tuesday, 1 is considered community-based transmission, 3 are linked to travel or other close contacts,
Right.
and 1 is still under investigation.
Right. 1 is still in investigation. 1 certainly traveled to an area, and in my opinion, it's travel related. But we haven't classified that as of yet because of the timing. We know there's a 14-day period of incubation, and so it's a possibility that it might not have been related to travel, but it most likely was, in my opinion.
That's the one that's still kind of under investigation. Okay, thanks.
Dr. Roussin, the last couple of weeks you've talked a lot about not stigmatizing people based on, in this case, driver's license and license plates. Are you seeing a lot of that as an issue in the province? Are you hearing a lot of cases where people are complaining about or saying that they've been that they've had action against them because of where they're from or linked to certain people? Are you hearing a lot of that?
Well, I certainly hear a lot of it. I think it's relatively low numbers overall that's actually taking place, but I hear still a lot of those type of things. We've heard of truck drivers and the concerns that they're facing. We've heard of issues, not necessarily only in our jurisdiction, but other jurisdiction, of seeing license plates from out of town. And I would just caution people that it is a line that we say a lot, but it's true. Is we are all in this together, and stigmatizing people and getting trying to shame people, that's not going to help us through this. So I just would really caution against that.
Dr. Roussin, I know you've touched on this before, but given that most of the cases we're seeing now are related to travel, what would it take to have to reinstate that 14-day self-isolation for Saskatchewan, Alberta, and BC? Yeah,
and so we're going to keep looking at those numbers. If we see significant community-based transmission that is escalating, then we might have to reinstitute those restrictions. We're not going to make decisions based on on a few days of escalating numbers and things. We meet with other chief medical officers of health twice per week, so we get updates of their regions. So we don't leave anything off the table. If we need to reinstate those travel restrictions, we will. But for right now, I just really think that we have to start getting understanding that we're going to see cases here. We're not going to see probably weeks and weeks of zeros. We're going to see cases, and when we deal with a pandemic, that's really not the goal, right? The goal is to limit the amount of cases, to limit the impact on the healthcare system, to limit the impact on those who are at risk for severe outcomes. But otherwise, the closure of travel, the closure of many businesses, also has impacts on health that we have to balance.
You cited a test positivity rate of 3% as an important benchmark. Is that the point at which you might start reinstating certain social distancing rules, including limits on public gatherings, perhaps shutting down businesses again, perhaps having an impact on schools opening?
Yeah, so it's certainly one of the most important indicators that we're going to follow, and the trend of that. Also, we look at things like the impact on the healthcare system, ICU beds that are up, that are taken. So yeah, it's one of those factors. And I think that as we learn more and more about this virus, as we learn more about the non-pharmaceutical interventions that we've done, as we move into fall, we really want to have this evidence and these guidelines decides to have a more targeted, a more surgical approach to closures and to public health interventions, rather than having to have those widespread public health interventions. So, but that is one of the most important indicators we'll be following.
But you don't look at it on its own. In other words, we might get up to a 3% test positivity rate, but if we still have nobody in hospital, nobody in ICU, and no more deaths, it may not necessarily be the trigger point.
That's correct, yeah, and the opposite of that might be true too. If we could need public health interventions at a 1% positivity rate if we started seeing our healthcare system overwhelmed.
You've been talking a lot about masks recently and getting people used to the idea of we might have to wear masks. You said so far you have no plans to mandate masks. At what point would you? I mean, why are you getting people ready for this?
Yeah, and I think that we're going to get into respiratory virus season this fall and winter guaranteed, and so we have to start preparing for that. And what the last thing we want to do is start limiting our healthcare resources like we had to do during this first wave, widespread public health closures. We really want to do whatever we can to avoid that. And so Manitobans are already really well versed in hand hygiene, staying home when ill, physical distancing. So that's always going to be in place during this fall and winter. If we're finding that that's not sufficient, then we need another measure. And that other measure, we don't want it to be closures again. And so that's where masks might come in.
Masks over closures.
Two more questions.
Okay, that's okay. I won't.
Anything else? Okay, thanks everybody.
Thanks.